So this is a training for Washington County Mental Health Services personal protective equipment use, how to put it on, how to take it off. First of all, we're starting out with our definitions of personal protective equipment will be referred to as PPE. This includes one-time use gowns, if available, N95 respiratory masks, face shield or goggles, if available, and gloves. Donning means putting on the equipment. Doffing means removing the equipment. Hand hygiene is how to wash hands to remove infectious organisms. The infectious field, the area in which an infected person is quarantined to, or 6 feet surrounding the individual. If the person is being isolated but must leave the space to access the bathroom, they should wear a mask when leaving their designated space. The bathroom should be disinfected after each use and before another person uses it. Quarantine means symptoms are present but no diagnosis of COVID-19 has been officially made. Universal precautions are indicated. Isolation means there is a positive diagnosis for COVID-19 and are restricted from leaving the designated assigned area for 14 days or for 3 days after cessation of fever without using any antipyretics such as Tylenol or ibuprofen for treatment or with clearance from a healthcare provider. Clarification of the N95 respirator fittings and challenges. If one person is sick and requires care, then one staff person should be assigned to care for the individual. The mask can be reused for one shift, then discarded to preserve limited inventory. All other PPE should be discarded after one use, such as gloves. Store the used mask in a clean, sealable paper bag or breathable container when not in use, and be sure to discard this when transitioning care to another staff. Men with beards or facial hair cannot obtain a clean seal with the N95 respirators. The only choices for this is to shave the beard off. No, we're not asking you to do this. Or to use a loop mask that is not as effective in screening out viruses. Long hair should be kept tied up on the back of the head to prevent the hair from becoming contaminated by the infectious field. There may only be limited numbers and sizes of N95 respirator masks, so options and choices may be limited. If none fit properly, then consider using a loop mask. So now we're ready to don the equipment. Refer to the pictured handouts on correct application of the gown or other options such as lab coats, patient gowns, aprons, etc. Not all the desired equipment will be available at all program locations, so please keep nursing apprised if there is an active infection being contained within an agency program. Gowns or alternatives should be fastened in the back and not the front, and they should be secured so they don't fall off during care. She's going to turn around and show you how to connect it in the back. And then you tie these straps together so that everything is on there securely. It can be tricky. There you go. Okay, so now she has the mask, the gown on. A string hanging down from the front is unnecessary. Don't worry about it. If it's in your way, cut it off. After applying the gown or the alternative, then apply the mask. Refer to the picture description for placement and securing. This includes the loop mask and the N95 respirators. If you're using a face shield or goggles, apply them now according to the pictured instructions. So for applying the mask, position the respirator in your hands with the nose piece at your fingertips. Cup the respirator in your hand, allowing the headbands to hang below your hand. Hold the respirator under your chin with the nose piece up. The top strap goes over and rests on top of the back of the head. The bottom strap is positioned around the neck and below the ears. Do not crisscross these straps. Place your fingertips from both hands at the top of the metal nose clip. Slide fingertips down both sides of the metal strip to mold the nose area to the shape of your nose. Now, in order to check your seal, you're going to place both hands over the respirator, take a quick breath in to check whether the respirator seals tightly onto the face. Place both hands completely over the respirator and exhale. If you feel leakage, there's not a proper seal. You feel any leakage? No. Okay. If air leaks around the nose, readjust the nose piece as described. If air leaks at the mask edges, readjust the straps along the side of your head until a proper seal is achieved. If you cannot achieve a proper seal due to air leakage, ask for help or perhaps put a loop mask on. So next, and that's the loop mask. Next is to apply the face shield or goggles. If you have a goggles, set a pair of safety glasses, that's good. If you wear glasses, those are acceptable too. And that's how you put that on. It's pretty easy. Lastly, and before entering the isolation area, apply correctly sized gloves. These should go over the top of the isolation gown or alternative sleeves to prevent contamination. Use the gloves to anchor down the sleeves of the gown. Be sure the isolation area has a box of gloves available in case they need to be changed during care. If the alternative to the gown has no sleeves, then be sure to wash the lower arm areas that were exposed after providing care and removing PPE. Now we're ready to doff the equipment, which is to remove it. There should be 2 containers positioned outside of the isolation area, one for trash and one for washable, reusable items. When exiting the room, close the door behind you. Remove gloves first and discard into the trash. See how she's peeling them off inside out? You don't want to touch the outer surfaces of the gloves. Remove the goggles or face shield and place in a pan for decontamination and reuse. Remove the gown according to pictured instruction and place it in the trash or into a laundry bin. See how she's taking it off inside out? She's trying not to touch the exterior surfaces of the gown because those are contaminated. You also notice she's still wearing some of the equipment. Okay. So now we're going to move the mask or the respirator last and either discard into the trash or store for repeated use as instructed. You see she's not touching the outside of the mask because that's contaminated. Okay, so when all PPE has been removed, staff must wash their hands for 20 seconds to remove any remaining contaminants. It's best to wash your hands instead of using hand sanitizer during this process to prevent transmission. You want to certainly do it for 20 seconds. Make sure you get your knuckles, your fingernails, between your fingers. Just do a really good wash up. Okay, we're done. I see we still got the water running, right? That's because we're not going to turn that off until she's got the paper towel, and then she's going to use that. She might also use the paper towels to open the door to get out of this room if she needs to, so she doesn't pick up any more organisms. It's very important to notify your program nurse if you have to implement an isolation setting. They will be tasked with making sure you have the equipment you need if it's available and ongoing monitoring of the evolving situation.